Hi everyone, welcome to Medici by Lakshmi. So today we will be discussing one of the important long answer question from general pharmacology, which is routes of drug administration. So what do you mean by routes of drug administration? Most drugs can be administered in a variety of routes. It's not like we can only administer one route in any one way. What is the most common kind of route of administration we see? It is oral administration, right? Okay, now we will discuss into more detail. This is just intro part. What are the factors affecting the choice of route of administration? One is the physiochemical properties of the drug. Second will be the site of drug action. Third is the rate and extent of absorption from the different routes. Effect of digestive juice and first pass metabolism. Routine treatment of emergency. Accuracy of dosage required. Condition of the patient. So it is very important to know all of these factors while choosing a route of administration for any drug. Now let's get into detail about the routes of drugs. So there are it is divided into two different parts, broadly divided into local route and systemic route. Now we will discuss each one of it in detail. Local route. Local route consists of topical administration, deeper tissue and arterial supply type of administration. In topical it's like skin, buccal mucosa, eye, ear, nose, everything come under topical application. Deeper tissue, subcutaneous, if you want you can write, it is also coming under the systemic route. Most you can write intra-articular injections and arterial supply. Okay. Now let's get into a little more detail of each the subheadings we have just now discussed. And also local route has minimal systemic side effects. Topical. Topical means we are externally applying the drug of choice into these areas where skin, buccal mucosa, eye or ear or nose. It is more convenient for patient. Patient can do it alone. Drug can be effectively delivered in the form of, what forms do you think, what form have you seen? Lotion, ointment, cream, powder, drops, sprays, etc. Okay. Inhalation of drug for action. Example, on bronchi. Have you seen inhalation things? That means people who inhale, of course our nasal sprays and everything used for inhalation on bronchi. Most used is salbutamol. Now next is deeper tissue. In deeper tissues, certain deep areas can be approached by injection. If we are using injection. Example one is intra-articular injection, second is the retrobulbar injection. We just need to write this much for these things. Arterial supply. Intra-arterial injection is used for contrast media in angiography. For contrast media in angiography, we are using arterial supply. Intra-arterial injection is being used. Now let's come to the second type of route, which is the systemic route. Systemic route consists of enteral, parenteral, Systemic route divided into enteral and parenteral routes. Enteral means it's going into the GITs. It's going into the stomach, oral, sublingual or rectal. Parenteral means we are directly injecting it. There is two types, injectable or non-injectable. Injectable subtype are IV, intravenous, intramuscular, subcutaneous, intradermal. These are examples. Non-injectable means inhalational, nasal, transdermal, transmucosal. Here we will discuss about all the injectable in detail, and non-injectable we will be mostly discussing about the transdermal. Okay. Now let's get into the enteral. So in enteral, what and all we said? Oral, sublingual, rectal. Now let's come to the oral. Oral, we have seen, is the most commonest mode of administration. Advantages, it is more safer. It is also more convenient. It does not need any assistance. And non-invasive, it's cheaper. Both solid dosage form and liquid dosage form are there. The points I have a tick using the violet color. You can remember it and you can write it in exam. All the other points, if you can remember, it's very good. But for people like me, I can only remember 2 or 3 points. So I make sure that I don't forget that point. Now what about the disadvantages? Disadvantages, oh my god. Disadvantages of oral route are action of drug is slower and thus not suitable for surgeries or emergencies. We can't give oral administration, and it is some unpalatable drugs are difficult to administer, so it is very bitter to administer it. We can't force them to eat or something. So that is one disadvantage. It also may cause nausea, vomiting, and it cannot be used in emergencies. What if the patient is in coma or is unconscious? Can you administer oral drug? No. Most used drugs, paracetamol, and next will be paracetamol most used one, and next is aspirin. Sublingual route, sublingual or buccal route. So what we are doing, we will keep the drug under the tongue. So drug or tablet or pellet is placed under the tongue or is crushed in the mouth. Advantage, it's very quick it has very quick onset of action, and it also bypasses first pass metabolism, which is very important, and it can be terminated by just spitting. Oral drug we can't even administer. If the person find is difficult, we can just spit it out. Example, glyceryl trinitrate. Now rectal route. Certain irritant or unpleasant drugs can be put into the rectum. For children, mostly rectal. For children only this route is used, mostly in children. Certain irritant or unpleasant drug can be put into the rectum as suppositories, retention enema for systemic effect. One of the disadvantages is that absorption is slower, irregular, and unpredictable. Example is diazepam and indomethacin. Okay. Next is the most important route, parenteral route, which I will be discussing in another video, because parenteral route itself is a 5-mark question. So while writing the routes of administration, you have to write parenteral route also, but I am going to discuss in the next video. So let's see in the next video.